Welcome to Three Questions With, a podcast by the Latino News Network, produced in collaboration with CAN TV. LNN is dedicated to best serving Hispanic Latinos with local multimedia news and information websites in the Northeast and the Midwest that includes Illinois Latino News, a statewide community-focused initiative. Three Questions With is a public affairs program elevating the voices and visibility of matters most important to the Hispanic Latino community by speaking with community and industry thought leaders on the social determinants of health and democracy. I'm Hugo Balta, publisher of LNN and your host. As many as 700,000 residents in Illinois who receive health care through Medicaid are at risk of losing their coverage. A pandemic-era rule that kept Medicaid patients continuously enrolled in the program during COVID-19 is coming to an end. A federal report found that nearly 5 million Latinos across the country, including in our state, are likely to lose Medicaid. That's despite many still being eligible because of challenges navigating the renewal process. Well, the Chicago Department of Public Health wants to uplift resources that the public may tap into to ensure they keep their health care benefits even if they no longer qualify for Medicaid. Joining us now to talk about Medicaid determination applications and other Medicaid supplemental health care benefits alternatives as well as other health matters is Dr. Geraldine Luna, Medical Director of the CDPH. Dr. Luna, welcome to the program, our first guest. I'm so excited. Thank you very much for investing your time.
Thank you for having me, Hugo.
Bueno, vamos a arrancar. La primera pregunta que tengo para ti is, tell us what's happening now that both the White House and Governor J.B. Pritzker plan to end their pandemic emergency declarations.
Yeah, and this is like incredible because the impact comes from both political and financial. What it means is that, for example, agreements between healthcare organizations and the state to provide data, that ceases. Additionally, it means that for the most part, Medicaid continuous coverage will come to an end, which means that individuals have to apply annually as they used to do before the pandemic to be recertified, and all these extensions and flexibilities that we once had to accommodate as much people under an insurance during the emergency automatically ceases. And another thing is testing, like COVID-19 testing, vaccinations, and treatments also, for the most part, will cease to be free for everyone but the uninsured. So there is some equity, important equity there, as it should be, and health departments and state and city are continuing to provide those for free, completely for free, for individuals that can't pay for that, especially our high-hit communities.
Yeah. And one of the things that I mentioned in the beginning of the program, and one of the reasons why we're having this conversation, is to talk about Medicaid and the Medicaid determination applications and other medical supplemental health care benefit alternatives, especially for those who no longer will qualify for Medicaid. Tell us about that.
Okay, the most important thing is for anyone, any familia that has right now the Medicaid, is important for them to update the information. Submit all the application, all the paperwork that it's needed to continue to protect their benefits without interruptions, because there might be some structural problems to that. So the city and all our allies are preparing to help and support individuals in this process hand in hand to provide and to connect. And if you haven't done so, familia, if you no lo ha hecho todavía, go to abe.illinois.gov, right there, and manage my case. Go in there, update your addresses, update your telephone information so you can get that rest certification application over the mail. For those that are not going to qualify, this is why it's so important to connect to various of our resources. 211 is one of them with Promotoras de Salud. Answer your phone in your language, in your culture, and ask you and drive you, navigate you through the process of recertification. And if you don't qualify, no se me desinflen, familia. Do not despair, because the state has put into new programs that I doubt that any Latino family would not qualify for any of those.
You just started talking about navigating health resources, and you mentioned 211. Tell us about what suburban Cook County residents, Chicago residents can expect when they call 211.
Yeah, Hugo, this is an important program, and it was not just by chance that it's there at this time, and particularly. We wanted to have it there to support. 211 is a call center. So the important thing to know, it's led by community health workers in Espanol and Spanish. These are promotoras de salud with sheer life experiences, with people that knows the lay of the land, because they're from there, our people's people serving the community, the Latino community. So they speak 105 languages, and you can call there now for the transition, for redeterminations for Medicaid, but you can also call for whatever emergent situation you might have right now, meaning se quedó sin casa, you lost your house, you lost your home, you don't have money to pay for utilities, you don't have child care services, or you need those. All those resources in the community, financial, educational, health, most importantly, and having a roof, having money to pay your house, all those resources, they connect you to those, and they continue to open the case and finish the case, close the loop, so individuals have all the support that they need while navigating this complex and very convoluted system, which is political and a lot of healthcare insurances, a lot of administrative processes there.
Muy importante que la información esté en el lenguaje, que sea en español o lo que sea, en el lenguaje que las personas se sientan más cómodas. So what a wonderful resource. So again, for more information on the Medicaid renewal process, it can be found on the websites of Cook County Health and Illinois Department of Human Services. Doctora Luna, a couple of weeks ago, you and I were part of a webinar hosted by Illinois Unidos. You sit on the board of directors for Illinois Unidos. I wanted to have a conversation, as we mentioned, the emergency proclamations and orders are about to come to an end. We know that all of us, right, we're tired, we're done with COVID. But COVID, for many of us, is not done with us, especially marginalized communities, y por supuesto hablando de la comunidad latina. Tell us about the impact that COVID-19 has had on our community and is still having on our community.
Hugo, when we started this pandemic, the first thing that we noticed was that the data was not accurate. There was a lot of underestimation of individuals that not only were impacted, Latinos were impacted 3 times as hard, 3 times higher than our white community, and it's because of all the social determinants of health, in the shortage, the poor end that we get. We're talking about individuals living, multi-generational families, having incredible barriers to healthcare access. 50% of the individuals here in Chicago, the uninsured, are Latinos. So we're talking about all the uninsured individuals in Chicago alone are Latinos, which drives to significant delays in healthcare, not only for chronic conditions, but in COVID-19, it was devastating. Essential workers, they were, hit so hard. Migrant communities, those were the first ones reporting incredible outbreaks of COVID-19 within those workers, without safety, without access to protector equipment, without laws or protections that they needed to be in place. Our systems, unfortunately, are racist and discriminate against Latino, against our advancement, because they were not written to include us in solutions. So that was the first indication that we noticed that the community was specifically devastated. And the data demonstrated that people were even dying at home. Immigrant communities, indocumentados, are undocumented, were dying in their beds because they didn't have, they just didn't want to go there because healthcare is prohibitive for any individuals that don't have a health insurance. And secondly, because they didn't want the persecution, migratory persecution, deportations and other things. They sacrificed their life to keep the other ones undocumented safe at home. So we saw all kinds of devastation. Horrible.
Especially with the most vulnerable, and you've mentioned the immigrant community, many of them that are undocumented, and many of them that are hiding in the shadows for fear of deportation or persecution or others. And it was so important, as you said, for an organization like Illinois Unidos to come together to really bring together so many other organizations to provide, to shine that light at some of the disparities, existing disparities that of course were exacerbated by COVID-19, and really start to beat the drum on the need for, both at the state level, at the local level, certainly at the federal level, getting the resources to the people who need it the most. Now, one of the guests that we talked to at that webinar hosted by IU was Dr. Jerry Krishnan, a physician scientist with expertise in the care of patients with asthma, chronic obstructive pulmonary disease, and lung complications of COVID, including long COVID-19. According to the CDC, the U.S. Centers for Disease Control and Prevention, Latinos have the highest rates of long COVID. About 9% of Hispanic adults report symptoms compared to 7.5% of U.S. adults overall. What is long COVID?
Long COVID is, it's known as post-acute COVID-19. It's also known as post-COVID complications or conditions. And it's normally a sequelae. It's a ramification of individuals that have suffered. And it can happen immediately after or during the disease, that it doesn't get better. And it has been reported from all different organ systems. For example, Hugo, what the most common complications of this COVID-19 sequela or consequence that stays on the long run with individuals is it can start by fever, rash, shortness of breath. A lot of individuals reported post-exertional fatigue. Something doesn't get better. You never completely recuperate. You don't bounce back to your baseline. And it starts compromising more and more. Even it's still showing up. You're supposedly cured from the disease, but these symptoms start coming up, showing and surfacing. And you have them from heart diseases, congestive heart failure. You have other complications which can lend on the long term. But you can have diarrhea. You can have problem sleeping. A lot of people describe a mental fog. They can't really go back to work because they're no longer productive. So we're talking about complications, and we don't even know because people are getting infected over and over, and we don't even know where this is going to land. But we know that it has become a huge issue in terms of incapacitating individuals, especially with those without health insurance or access to vaccine, other COVID therapeutics that can be the cure. I mean, a vaccine can help you not develop it. Or the COVID therapeutics can have you, not save you completely, but can avoid you developing further these symptoms if taken within the window, if taken on time, but that means having access to healthcare.
Yeah, and one of the things that you mentioned, there's the whole aspect of taking care of the person with symptoms, obviously physically, but it's also about mental health. There's a toll that COVID has taken on both people who have unfortunately had COVID, sometimes more than once, and then those that are walking on eggshells thinking about the emergency being lifted and already seeing in many public places people not wearing masks and that fear of getting sick. So absolutely, there's still so much more to be done, especially as we look at Latinos and other marginalized communities who are still struggling with COVID-19.
Anti-Asian hate is not a new phenomenon in the United States. Unfortunately, the COVID-19 pandemic increased incidents of hate towards Asian American communities. This week on Change Agents, we will meet some leaders who are fighting back and working towards a more inclusive and equitable city. Join me Thursday at 7:30 p.m. on CAN-TV 19, stream us live on cantv.org, or watch us on the CAN-TV Plus app.
You're listening to Three Questions with Dr. Geraldine Luna, Medical Director of the Chicago Department of Public Health, member of the Board of Directors with Illinois Unidos, just to name two of the many hats she wears. We've been talking about Medicaid determination applications and other Medicaid supplemental health care benefits alternatives, and of course, COVID, then, now, and what's next. Now, I want to spend a little time talking to you about you, because so often when you're interviewed or you're quoted on the paper, it's always your name and your title, of course, the work that you do, but you're so much more than that. And I think it's really important for our audience, for the public, to learn more about who you are and what it's inspired you to do the work that you do. Entonces, cuéntanos un poquito de ti. ¿Dónde naciste? Where were you born? Where did you grow up? Tell us a little bit about your upbringing.
Of course. I was born in New York. Esta jibarita que está aquí was born from Puerto Rican parents. And then at the age of 6, we went back to Puerto Rico. We're the example, the perfect example, multi-generational family. I went to live with my abuelita. And we were talking about my family, my mom's family, which is a family of 6, living with another family, my tío's family, which is a family of 5, y abuelito y abuelita, which added 2 more individuals, 1 house, 1 bathroom. Hugo, don't ask me how we did it, but we were happy. We were, of course, there was no disparities. We didn't see, everybody had the same thing. Rural area, minimal access to all the amenities that we know. But that was my growing up. Those are my roots. One of the things that I think that shaped me in a way that I can't forget is not having health insurance. My abuelita would suffer. She was a smoker, characteristic of the elders of that age. She used to smoke, and she developed COPD, which is a respiratory condition that, with time, it takes you die from that. So she would start deteriorating physically, clinically, and then we started to receive the impact, because in our Latino family, when one member is sick and you have to take care of that, everybody in the household suffers. So she would go different times at night. We were back and forth to the emergency room, and she didn't really have an insurance for preventative care. So that was the first awakening. I then decided, having seen all that happen, becoming a doctor. So I'm the first one to go to college in my family. I'm the first one to be able to become a medical, go to medical school and then go a residency and do post-training in geriatrics, which I did in internal medicine and then in geriatrics, and then develop a master's, took the classes and obtained my degree, a master's in public health afterwards. But that happened later. My abuelita passed away. It was so sad. But she was like the matriarca, that person that even though that she couldn't have, she didn't have the means to develop herself professionally, but her resiliency, the strong person, I'm not giving up, I'm fighting for what is right, was something I think she inherited to the rest of us. So then when I married and I came here to the United States, to Chicago, I did my training in geriatrics, as I mentioned. I became a staff member there, and it was here in Chicago with segregation and marginalizations that I realized that we're not equal. Families we're not part of that majority. There's difference, and it's starting to take impact and toll, and you see it in life expectancy. This is the first time I ever heard of a difference, racial difference in life expectancy. What does that even mean? Familia, diferencia. Not everybody lives the same amount of time, even though we're in the same space in Chicago. You can cross a street and people on the other side of the street live 30 years more than you. Does that even make sense?
It's mind-boggling.
It doesn't even make sense. So those were the drivers, not only to get my master's in public health, have a little more understanding, but also to start uniting and advocating for changes in policy. Representation came to my mind for the first time, knowing that individuals that speak the same language as you, have the same cultural background, they look like you, can have an effect on outcomes, health outcomes, and individuals be in a better position to even make informed decisions about their health. That I learned as a doctor, and I solidify as a public health provider. So Hugo, in a nutshell, I have a 23-year-old daughter, 24 now. She's in medical school too. She married another student that with her spouse, el yerno mío, I'm sorry, is now they're both studying medicine, and this is a strong call for individuals. We need more voices. We need people like you, Hugo. We need healthcare workers, forces there. We need policy makers that look like us. If we don't have the proper representation, we will never change the narrative of the people of a Latino population here in the United States. So this is me in a nutshell. This is my work, my passion, and that I do. I joined Illinois Unidos. You know the rest. This is a very strong advocacy group, more than 400 organizations. We were a couple of days ago in Latino Unity, in the Latino Unity Day in 2023 in Springfield, advocating for Medicaid expansion for the immigrants, including healthcare workers within a certain group that are the productive group. We were having this conversation a couple of minutes ago. But Hugo, this is who I am. This is my love. This is my passion. And I hope that we can see changes. We can start affecting changes. Because I do believe that if we come together as a group, as Latinos unite, we will be able to make a change here. Hugo, just to give you some perspective of what's going on in our community, 50% lost their jobs in COVID-19 the first year. And 20% of our kids drop applications to college in the first year. And in the first year, the Latino community had the steepest fall in life expectancy just because we added an emergency, a new aggravator. So imagine if something else, bigger than COVID, comes and hit us. Yeah. Will we survive?
Yeah, and it's not just us surviving, it's also the rest of the community, because there's a symbiotic relationship. And as you said, pre-COVID, the numbers were looking good, and then COVID hit us, and it was multi-pronged. It's not just about the health, it's about jobs, it's about housing, and again, if the Latino community sneezes, the rest of the community in Chicago, Cook County, and the state of Illinois, they catch a cold. Dr. Luna, I couldn't have asked for a better first guest in this collaboration with CAN TV for Three Questions With. You are inspirational and aspirational. You're someone that inspires me to do better, and you're aspirational because necesitamos a más personas como tú para que la juventud te vea a ti, entienda, to learn your story and say, si ella puede, ¿por qué yo no? Muchísimas gracias. Thank you so much for joining us today.
Good. Hugo, me honra la presencia estar aquí. Gracias por todos esos comentarios. They're very flattening. This is a humble worker here, and hand in hand, we're hoping to make a change. Thank you for having me.
Hi, I'm Ryan G. I'm the host of Tweenish.
Representation is super important, like you here doing this podcast, right? Showing other brown girls all around the world that they can do things that are new and exciting.
Tune in to my show every single week on CAN TV 19. I'm personally excited. Are you?
You've been listening to Three Questions with Dr. Geraldine Luna, Medical Director of the Chicago Department of Public Health. Before I let you go, some final thoughts about healthcare. Many people in the United States don't get the healthcare services they need. About 1 in 10 people in our country don't have health insurance. People without health insurance are less likely to have a primary care provider, and they may not be able to afford the healthcare services and medications they need. This is especially true for marginalized communities. More than 23% of Latinos live in poverty. This community is much more likely than other groups to work in agricultural, construction, domestic and food services, and other low-wage occupations. The socioeconomic and labor obstacles prevent them from receiving timely and appropriate health care. Adding to those barriers are specific features of the Latino population, like different degrees of acculturation, language, immigration status, and retaining their cultural beliefs and behaviors regarding health and healthcare. Finding solutions to overcome a variety of financial and non-financial barriers for Latinos to obtain appropriate and timely health care will require providing culturally competent responses. These include promoting and incentivizing worker safety protection measures, particularly for those in low-wage economy. Ensure appropriate resources are available for addressing and managing health care in a culturally and linguistically appropriate manner. And increase the number of mental health services and programs serving the Latino community. Health is a human right. The right to health for all people means that everyone should have access to health services they need when and where they need them, without suffering financial hardship. No one should get sick and die just because they are poor or because they cannot have the health services they need. Well, 3 Questions is a collaboration by Illinois Latino News and CAN TV. I invite you to look us up on our websites and chat with us via social media. Tell us what you thought about the topics we covered today, and please send me suggestions about what you think we should discuss next. Because at the Illinois Latino News, you're more than just an audience, you are our contributors. I'm Hugo Balta, publisher of LNN. Thank you all for listening.